Hi, I'm Dennis Richardson, State Representative from Southern Oregon, and I'm here on behalf of the House Republicans to talk about the most important legislative bill of the week, the Healthy Kids Program. Now, we're all concerned about having healthy kids in Oregon, but we need to assure that we have a program that is sustainable, that's reasonable, and that it's affordable. The Healthy Kids Program, as it's presented, has 4 flaws, and we need to make sure that those flaws get corrected before we vote this bill into law. The flaw number 1 is that the Healthy Kids Program provides benefits for kids from families that earn up to 3.5 times the federal poverty limit. That means for a family of 4, in 2008, when the bill actually goes into force, they could be earning $73,000 and still get taxpayer subsidies. We've got one Republican in our caucus who has 4 kids. He said he looked up, he could be earning $90,000 and still have federal or state subsidies for his kids under the Healthy Kids Program. 350% of federal poverty level is not a health plan for the children of poor and needy. It's a middle class plan, and Oregon doesn't need that. The second flaw deals with who's covered by the Healthy Kids Program. It says it covers all children in Oregon under age 19. Well, that sounds good, except that the federal government will not pay anything toward funding programs for children or adults that are in Oregon illegally. Now, there are certain programs in cases of emergency where funds are paid to help children or adults that are here illegally in an emergency situation. But the Healthy Kids Program provides dental, vision, and medical bills that are preventive in nature, as well as those that could be used in an emergency situation. We need to assure that we are not using Oregon tax dollars to pay for benefits for people who are here illegally. That's a flaw, and it needs to be corrected. The third problem with the Oregon Healthy Kids Program is that the state workers would not even be able to contact immigration authorities if they know that they're signing up people who are illegally in Oregon. Essentially, we would be making Oregon state workers complicit in the breaking of the law by these people that should not be here at all. And that's wrong. When we have laws on the land, whether it's federal or whether it's state, we need to assure that we don't put our state workers in a position where they're having to break the law or be silent when they know the law is being broken. The fourth flaw with the current draft of the Oregon Healthy Kids Program is that it's being funded, or it's intended to be funded, by an 84-cent per pack increase in the tobacco tax. Now, I'm no great lover of people that spend a lot of money smoking tobacco, because the problem is that will cause a lot of health problems that we end up having to pay as taxpayers in the future. But if the Healthy Kids Program is important, and we Republicans believe it is, then it should be funded out of the 20% increase in revenues that the governor is going to have to spend over the next 2 years. That 20% increase in revenues from income tax and from the lottery it contains money that we can use to help assure that Oregon children that are needy have the health care that is important for their well-being in their future. And so to tie this into a tax that is not going to be able to fund it in the future is to not give the sustainability that we deserve when we're about to have a law that's going to be on the books for years to come. With the cigarette tax, there's enough money that would be generated to pay for healthy kids in the next 2 years. That's some $80 million when you look at all the various programs that are involved in this plan. But what it does is it says that we're going to generate enough money to pay not only for Healthy Kids Program this next 2 years, but for a bunch of other programs as well. And so since the Healthy Kids Program doesn't even begin until January 1st of next year, I mean 2008, and it takes time to ramp up, it's going to cost them $80 million for this biennium, but well over $142 million in the next 2-year budget. And since the amount of money that's being allocated from the increased tobacco tax will be spent in several different areas, there won't be enough money to pay for the Healthy Kids Program even 2 years after it starts. It's a mistake to say, well, we'll just take the money from somewhere else. If you're going to have a hole of over $70 million in the 2009 through 11 budget, then you shouldn't be just passing a program because you think that it's a good idea. We need responsible government. And responsible government in Oregon means that when you start a new plan, or if you're going to expand an old one, you look at where the money's going to come to fund it for at least the next 10 years. That hasn't been done with the Healthy Kids program, and that's a mistake. We House Republicans thought you might want to know. Thank you.